Issues Reports is made possible by Paul and Swanee Damari, advancing lifelong learning and impacting change for a better South Florida.
Alzheimer's disease. It's one of those conditions that we think we know something about until we experience it firsthand. Then we realize that it can be much more insidious than we could have ever imagined.
Today, Alzheimer's is like the proverbial perfect storm, an age-related disease brewing out at sea, speeding towards the coast as the population ages at a historically rapid pace.
With 77 million baby boomers and 10,000 people turning 65 every day, the statistics looming ahead for the nation are mind-boggling. If no treatments or cures are discovered, the number of Alzheimer's cases in Florida alone are expected to go up 21% in the next 5 years, 55% in 10 years, and almost 300% nationwide in 35 years, costing the U.S. more than today's combined Medicare and Medicaid budgets of $954 billion, an estimated $1.1 trillion a year by 2050.
So what is Alzheimer's disease, and why is it such a drain on caregivers? Why is it the most expensive disease in America? And what are the federal government and state of Florida doing to prepare for this pending storm? Will it be enough?
Do you remember this one?
You hear about Alzheimer's and the toll it takes on people, but until you live it yourself, it's impossible to understand the scope of the disease on the person who has it, as well as the impact on those who care for them.
We've been married 47 years, dated for 6 years before that. We started dating when we were juniors in high school.
Like many couples, Phil and Naomi retired to South Florida in 2010. It was a place that they loved and knew very well, and it was close to their children. Then they started noticing that Naomi was having trouble with her memory.
We started to notice more and more instances where she couldn't come up with the right word, or she'd say something like, she's drinking a cup of coffee and it maybe got a little cold, and she'd say, hey, put this in the refrigerator and warm it up for me. Those kind of situations. And after about a year down here, it became a little more noticeable in terms of just daily living and doing things. And that's when her family physician suggested that she be evaluated.
Hello, Naomi.
Hi.
How are you?
The loss of memory is the characteristic symptom, the first symptom that occurs. The other feature of the disease is that it's recent memory, not remote memory. You look at my nose here. You see my finger moving?
Dr. Ranjan Dwara is a neurologist and research physician who has been caring for patients at Mount Sinai Medical Center in Miami Beach for 30 years, the last 28 as the medical director of the Mount Sinai Wean Center for Alzheimer's disease and memory disorders.
The recent memory is not available to them, and so the repetitiousness is a characteristic symptom of Alzheimer's disease. As part of the memory loss, misplacing things is very common, can't find this or that. It merges with what happens with normal aging, but it's more severe. And it begins to interfere with everyday function. Touch my finger here.
Fortunately, Naomi was promptly diagnosed and given early care that has helped keep the severity of her disease from rapidly progressing.
For the last 2 years, they don't see a noticeable decline. There's a slight decline, and maybe it changes from day to day, but she's on medication, and they basically say she's holding her own.
Alzheimer's disease is an irreversible progressive brain disorder that is the most common form of dementia in older adults and affects as many as 5 million Americans aged 65 and older, in addition to their families. Alzheimer's causes once healthy neurons, a type of brain cell, to lose their ability to function and communicate with each other. Eventually, the damaged cells die.
I think, we're dealing with quality of life, and
To be sure, experts say that early diagnosis and immediate comprehensive care are key to keeping the worst effects of Alzheimer's disease at bay for as long as possible, although actual disease-modifying treatments have yet to be developed.
We have treatments for Alzheimer's disease that have been approved by the FDA. These are treatments which are known as symptomatic treatments. So they treat the symptoms of the disease, but they don't really change the underlying disease process. They don't really slow down the underlying disease process.
The physical, emotional, and financial toll exacted by this long process of decline is devastating to those with the disease and their loved ones. In the final stage of Alzheimer's, people lose the ability to recognize family and friends and become completely dependent on others for daily care.
How are y'all doing?
The hardest thing for me, I think, was adjusting to the fact that we're so inclined to look at our medical profession as they can fix anything. You got some little illness, they give you some penicillin, they give you some whatever antibiotic, and a few days you're fine. And with this one, there's no cure, there's no explanation of what really causes it, so there's not much you can do to improve your lot, and the prognosis is, fatal. So you can't think, I can work my way through this.
Whenever you think about someone who has lost the ability to remember and to remember daily tasks, you have to understand that that person is going to need someone else who will remember those tasks for them.
Dr. Angela Arocena is the Vice President for Easter Seal South Florida Adult Day Services in Miami.
You have to understand that this other person who's doing the remembering and who's doing the assistance is really living two lives.
Alzheimer's disease does not just have one victim, it has multiple victims. The caregivers are victims.
So you can imagine how difficult that is for the family. Emotionally, because they're seeing their loved one fade away gradually. Physically, because they have to provide a lot of physical assistance oftentimes. But also financially. You can't talk about a person with Alzheimer's without talking about the family. You can't. You can't help a person with Alzheimer's if you don't help the family.
This is our caregiver support group.
Indeed, Alzheimer's treatment must include helping the caregivers sort through a wide variety of issues, connecting them to community resources such as daycare, transportation services and support groups, and providing counseling, education services, and home respite care, all while working through the financial issues. Some community resources include Easter Seals Adult Day Services in Miami, considered to be a model adult daycare center by the state of Florida. But even though funding has risen in the last several years, so has the demand to get in.
Nice.
Alzheimer's Association, this is Rebecca.
The Alzheimer's Association is another leading resource, offering a helpline available 24/7, staffed by professionals with a master's degree. The Alliance for Aging is one more key community asset that helps provide a wide variety of services for the elderly. Max Rothman has been the president and CEO since 2007.
Our job is to plan, fund, provide oversight, advocate on behalf of older adults and their issues, and we work across the entire panoply of issues involving older people.
They're never going to be able to say that they rehabilitated and they're now back to being functional, to be independent. That's not going to happen, not now, not until we find a cure.
Therein lies why Alzheimer's is the most expensive disease to treat in America. Eventually, people with Alzheimer's will ultimately require some type of 24-hour skilled nursing home type care, and it isn't cheap.
The way I see it, this is a race between funding and the number of people that are being diagnosed with Alzheimer's. And Alzheimer's is winning.
there is great concern about the increasing number and prevalence of Alzheimer's disease and related dementias among our older population. We have more people living longer, and we know from the research literature that for every 5 years that you age, the prevalence of Alzheimer's disease increases. So if we have more people living longer, the result is we're going to have more Alzheimer's disease.
It's a public health problem, and we're in the epicenter, I'd say, here in Florida, especially in South Florida, of the Alzheimer epidemic. And we really need to prepare for it. Are we prepared? No, we're not.
Forward.
In Miami, it's particularly complex because 65% of older people are Hispanic, and Hispanics have a higher prevalence of Alzheimer's disease. 15% are Black or African American or Black from the Caribbean. Also a higher prevalence of Alzheimer's disease. So we've known these things, we know they're coming, and we've spoken about them. The network is there, the agencies are there, but it's always going to be a challenge to keep up with the numbers as we move forward.
To that end, the federal government has been working to increase funding for research with the goal of achieving viable treatments and cures by 2025. Most recently, a federal government appropriations subcommittee approved a $300 million increase for Alzheimer's research for 2016, making the budget close to $900 million. Though historic, some would say this increase is still not enough. Final approval by Congress is also needed.
We made that investment in trying to combat things like cancer and heart disease and HIV/AIDS, and we certainly need to address Alzheimer's with the same sense of urgency.
In addition to the plan by the National Institute of Health, the state of Florida created the Purple Ribbon Task Force to recommend a course of action to deal with the explosion in Alzheimer's cases.
Close to 50% of older adults that are in nursing homes have Alzheimer's disease. A large number that are in assisted living facilities and adult daycare programs have Alzheimer's disease. They will continue to have to expand.
It's not just about having individuals who are nursing assistants and physicians and neurologists. It's individuals who are nursing assistants who know how to take care of people with Alzheimer's. It's physicians who know how to diagnose and treat people with Alzheimer's. It's a very unique population that have special needs. So you have to provide the training, the guidance, the legislation.
You did wonderful.
And the financial resources so that these things can happen. It's not going to happen just in a vacuum.
The federal government is also counting on medical research to come up with treatments and cures by 2025 to alleviate the crunch of aging baby boomers getting Alzheimer's disease. There is a tremendous research effort going on to develop preventative treatments in order to intervene as early as possible, including before a person even experiences any symptoms.
10, 15, 20 years prior to the onset of the disease, we can identify the beginnings of Alzheimer's disease by showing that there's amyloid in the brain. The fact that that we have this window of opportunity to intervene allows us to then test out different drugs that might be able to either remove the amyloid from the brain once it's deposited, or to prevent its toxic effects on the brain.
The research sounds promising, so why is it so difficult to get the necessary funding?
I think those who are decision makers already know that there is a problem and that it's not just being addressed. Do our legislators need always to work under pressure from the public in order to make decisions that are meaningful? I don't know. Those of us who are in the field are advocating, are trying to influence, are educating. But there's a limit to how much we can impact.
But for now, Phil and Naomi continue to take it one day at a time.
Don't give up hope, don't give up living, but just relax and try to take little steps. Just be thankful for the days that are good, you know, and don't overly complicate your life.
All patients and caregivers can do now is wait and hope that one day they will get the support they truly need. As we mentioned in the piece, there was an increase in federal funding recently, but what are state and local policymakers doing to strengthen Florida's commitment to end this devastating disease and related dementias? What are they doing to improve care and research and ultimately remove the stigma associated with Alzheimer's disease? Joining me to continue this conversation, we welcome Florida State Senator Rene Garcia, representing District 38. He is also chairman of the Senate Health and Human Services Committee. Thank you for being here, Senator. So glad to have you back for this really important conversation. So when we look at this issue, we look at the aging population, baby boomers. There was a study that came out recently that indicated that by 2020, over 60% over 33% of Miami-Dade County residents were going to be 60, 65 age and older. This is a disease that really affects the aged. So what is the state of Florida doing to prepare?
Look, Ellen, thank you so much. And this was such a great report, and it's a great segue to come to have this conversation. Your report was full of great information. And when we look at these percentages, let's not forget that these are people. And when we talk about the age in the state of Florida, when we see an increase of 44%, or 40% of the people, elder population is going to have some form of dementia or Alzheimer's. When we look at that number, when we transform that number is about 750,000 people over the next 10 years. That's a lot of individuals suffering from some form of dementia. And I think what the legislature has done in the mid-1980s, what we did, and I wasn't there and I can't take credit for this, but they created the Alzheimer's Disease Initiative, understanding that this was a problem that we were facing, especially with all the baby boomers coming down to the state of Florida and aging and coming here to retire, and seeing that these numbers were continuously increasing. And we created this initiative, and now in the base, we have about $18 million in base funding that goes out for services for individuals with Alzheimer's. And this year, we were able to increase it by about $2 million, which $1.7 million went directly for these services. But let me tell you this, Ellen, $1.7 million in increase only took off about 160 people from the wait list, which is currently at 3,500. So it's an expensive disease that we have to continuously fight to ensure that we take care of these individuals.
Absolutely. And when you look at it from a state level, it's one issue. But for those who live in South Florida, and you are from Miami-Dade County, it is another. You look at the Easter Seal Society, where they have adult daycare facility, because Easter Seals takes care of children as well as adults. There was an item in the budget that sadly, I don't think got approved.
Yeah, unfortunately, this year the governor, part of the $450 million that he vetoed an Easter Seals program actually in Central Florida, and a lot of programs that were here for Dade County, especially those programs as it relates for elder care and elder programs. It's really an unfortunate situation, but it's part of the political process, and I think that we, as a delegation, as a county, and as a community, have to come together and demand answers. Why were some of these programs vetoed, and why were certain programs vetoed over others? And I think that now it's a time for us to come together as one community and ask these questions.
And one of the things that we look at, and I'm so glad that you mentioned that
We look at dollars and we look at population figures and percentages, but we are talking about human beings, men and women, and we're talking about their families and the impact on the families. More women than men develop Alzheimer's. Women are traditionally the caregivers in the family. So you look at it, one of the cost factors is that there comes a point in time where the patient needs health care 24/7. And it's that human capital that requires special investment. So if we're looking at devastating, alarming statistics over the next 5 to 10 years, seems like the conversation we should have, we tried having it early on, as you point out, in the 1980s, but now we're a little bit behind the game. So how can you and others help lead us so that in our next legislative session, and even local authorities, be ready to prepare for this alarming situation?
I think the Alzheimer's disease initiative is really helping in trying to bridge that gap. Can more be done? Absolutely. But it does take resources.
But it's like everybody's waiting for the miracle to occur. And because baby boomers are such a big number, I don't know. I mean, the kind of miracle we're asking for is, well, it's going to be a miracle.
No, look, and Ellen, and you touched upon something very important. It's not just the patient. The biggest problem that you have with Alzheimer's is the pressures that are put on the family. These families that are taking care of these patients. And look, Ellen, as a matter of fact, look, before I got on the show today, I received a call from a constituent. It's a call that I receive far too often now, and it becomes more and more repetitive in our office. People know that I'm the chairman of the healthcare committee, and I've been doing this for many years. But what I'm starting to find out is that individuals that have Alzheimer's or some form of dementia are having difficulties in being placed in long-term care facilities, like a nursing home or an ALF. Not a lot of nursing home or ALFs will take individuals with Alzheimer's because it takes a lot of resources to take care of this individual. So we are having that difficulty in our own community, and we have to figure out a way to start addressing these issues when these individuals are getting older and their families, unfortunately, cannot take care of them. It's not that they don't want to. They want to. They want to be there. They want to be responsive to them and take care of them. Excuse me. But it's just physically impossible for an older couple, an older wife or an older husband to be able to pick up and transport the patient or the family member to and from the doctor, or even to and from the bathroom and the bedroom. So we have to start addressing those needs in our community right now, because it's just going to get worse.
Where are the competing dollars going? I mean, Alzheimer's, there's so many important organizations, and the idea is that one would really not like to have to pick, either or propositions. But where do you see, given your position as chairman of this important healthcare committee, where do the dollars end up being divided?
No, unfortunately, healthcare, we don't have unlimited funds. And when you look at the healthcare budget, there's so many competing issues, and I can't say that one is better than the other one, because you have issues with children with disabilities, you have cancer research, HIV research, HIV medications, you have a slew of different healthcare priorities, and it just depends on the time of year and who is out there advocating loudest. As you see now, we do have $18 million in funding for the Alzheimer's disease initiative, but we need to increase that. We need to make sure that those monies are going to direct services and taking care of the patients and family. Far too often, Ellen, when we look at our healthcare budget, and what I've discovered, and especially in mental health, is that we fund a lot of programs, but we never go back and audit these programs to make sure those dollars are being administered in a proper way and that people are receiving those actual services. I think it's incumbent upon the legislature and upon the executive to make sure that whatever dollars go out are being spent directly for services and being spent in a proper manner. And if we do that across the board in healthcare, that'll free up a lot more money so we can invest in programs like the Alzheimer's disease initiative.
That's such an important point. Let me ask you, in the minute and a half that we have left, how can families organize? How can people who are interested, how can we affect decision makers? I know you're on board, but how do we join together to make others more aware of this pressing need? What do you suggest?
Look, I really do believe this, and until I say this until I'm blue in the face. This is a representative democracy, and we elect our elected officials to represent us. I think people have to get engaged by going out to their legislative offices, to going out to their local community offices, their county commissioners, and speak up. If you don't speak up, you will never be heard. And that's what we elect people like myself to represent this community. And it's about time that this community stands up and demands the services that need to be demanded for Miami-Dade County and for the state of Florida. And when we talk about the Alzheimer's initiative, these are programs that do good. And these are programs that are making a difference in people's lives. And those are the programs that we need to fund on a continuous basis and continue to increase the services if we know that the return on investment is working on our behalf.
And I have no doubt, Senator Garcia, that given your leadership and those of many of your colleagues, that there's going to be a real call exactly for that, for those to stand up for those who are no longer able to speak, but also for the families who are affected. Thank you so much, Senator Rene Garcia, for being with us today. And I'm Helen Ferre. Thank you for watching Issues Reports with you in mind.
Issues Reports is made possible by Paul and Swanee Damari, advancing lifelong learning and impacting change for a better South Florida. Issues Reports is made possible by Paul and Swanee Damari, advancing lifelong learning and impacting change for a better South Florida.
Alzheimer's disease. It's one of those conditions that we think we know something about until we experience it firsthand. Then we realize that it can be much more insidious than we could have ever imagined.
Today, Alzheimer's is like the proverbial perfect storm, an age-related disease brewing out at sea, speeding towards the coast as the population ages at a historically rapid pace.
After about a year down here, it became a little more noticeable in terms of just daily living and doing things. And that's when her family physician suggested that she be evaluated.
Hello, Naomi.
Hi.
How are you? The loss of memory is the characteristic symptom, the first symptom that occurs. The other feature of the disease is that it's recent memory, not remote memory. You look at my nose here. You see my finger moving?
Dr. Ranjan Dwara is a neurologist and research physician who has been caring for patients at Mount Sinai Medical Center in Miami Beach for 30 years, the last 28 as the medical director of the Mount Sinai Wean Center for Alzheimer's disease and memory disorders.
The recent memory is not available to them, and so the repetitiousness is a characteristic symptom of Alzheimer's disease. As part of the memory loss, misplacing things is very common, can't find this or that. It merges with what happens with normal aging, but it's more severe. And it begins to interfere with everyday function. Touch my finger here.
Fortunately, Naomi was promptly diagnosed and given early care that has helped keep the severity of her disease from rapidly progressing.
For the last 2 years, they don't see a noticeable decline. There's a slight decline, and maybe it changes from day to day, but she's on medication, and they basically say she's holding her own.
Alzheimer's disease is an irreversible progressive brain disorder that is the most common form of dementia in older adults. It takes on people. But until you live it yourself, it's impossible to understand the scope of the disease on the person who has it, as well as the impact on those who care for them.
We've been married 47 years, dated for 6 years before that. We started dating when we were juniors in high school.
Like many couples, Phil and Naomi retired to South Florida in 2010. It was a place that they loved and knew very well, and it was close to their children. Then they started noticing that Naomi was having trouble with her memory.
We started to notice more and more instances where she couldn't come up with the right word, or she'd say something like, she's drinking a cup of coffee and it maybe got a little cold, and she'd say, hey, put this in the refrigerator and warm it up for me. Those kind of situations. And
with 77 million baby boomers and 10,000 people turning 65 every day, the statistics looming ahead for the nation are mind-boggling. If no treatments or cures are discovered, the number of Alzheimer's cases in Florida alone are expected to go up 21% in the next 5 years. 55% in 10 years, and almost 300% nationwide in 35 years, costing the U.S. more than today's combined Medicare and Medicaid budgets of $954 billion, an estimated $1.1 trillion a year by 2050.
So what is Alzheimer's disease, and why is it such a drain on caregivers? Why is it the most expensive disease in America? And what are the federal government and state of Florida doing to prepare for this pending storm? Will it be enough?
Do you remember this one?
You hear about Alzheimer's and the